In this presentation, we will introduce the functional areas of employee benefits and safety. Many other companies have adopted a more is better philosophy in designing their benefit plans. However, probably just as many have cut back on benefits due to the rising costs of healthcare. Benefits can cost employers anywhere between 18 and 26% or even higher of a worker's base pay. We will also discuss safety in the workplace, a topic immediately related to employee health and wellness. Mandatory benefits in the United States include Social Security, workers' compensation, unemployment compensation, and family and medical leave. Additionally, beginning in 2015, employers will be responsible for the Employer Shared Responsibility provision of the Affordable Care Act. At its core, social insurance protects employees against job-related risks, disability, death, unemployment, and so forth. The goal of social insurance is to improve not just the lives of individual participants in social insurance plans, but society as a whole. The Social Security Act was one of the first social insurance programs implemented in the United States. President Roosevelt signed it into law in 1935, and it went into effect in 1937. The act created the Old Age and Survivors Insurance OASI program. Its purpose was to provide retired workers with a continuous stream of income after their retirement. The Social Security Act was passed in the United States in part because workers were becoming less likely to have extended families to care for them in later years of their life. In 2014, the Social Security tax rate, which funds Social Security, was 12.4% of an employee's salary, shared equally between the employee and the employer on earnings up to $117,000. Employers withhold Social Security taxes from employee paychecks and submit the funds to the Internal Revenue Service. Medicare is the health insurance portion of Social Security for retirees at age 65E or older and disabled workers. The Federal State Unemployment Insurance, or UI program, created by the Social Security Act of 1935, provides temporary financial assistance to eligible workers who lose their jobs through no fault of their own. Almost all workers are covered by the program, although the eligibility requirements are determined by state laws. Employers must pay a minimum amount of federal unemployment tax if they have one or more employees in at least 20 calendar weeks, or have one or more employees paid $1,500 or more in wages in any calendar quarter. Workers' compensation was actually the first type of social insurance developed widely in the United States. In 1911, the state of Wisconsin established the first work comp program. All 50 states, as well as the District of Columbia, Puerto Rico, and the Virgin Islands, have some type of work comp program. Typically, workers' compensation provides cash benefits and medical care to employees when they suffer injuries or illness related to their employment. It also provides survivor benefits to dependents of workers who die due to work-related incidents. Workers who receive these benefits are not permitted to sue employers for damages of any type. The Affordable Care Act was a long-awaited effort to extend health care to many Americans not covered by employer or private plans. President Barack Obama signed the act into law on March 23, 2010. The law had several goals: improving quality and lowering healthcare costs, providing greater access to healthcare, and providing new customer protections. Some of the main features of the law include ending pre-existing exclusions for children, requiring employee healthcare plans to cover young adults up to age 26, and ending lifetime limits on coverage for all new health insurance plans, as well as limiting administrative costs by insurance company and providing certain types of preventative care at no cost. Beginning January 1, 2015, employers with 50 full-time employees, or a combination of full-time and part-time employees that equal 50 full-time employees during the previous calendar year, will be required to be in compliance under the law. The Affordable Care Act Employer Shared Responsibility provisions of Section 498OH of the Internal Revenue Code apply. For purposes of the Affordable Care Act, a full-time employee is someone who works an average of 30 or more hours per week. Employees who meet the requirements to comply with the Act are known as applicable large employers. Under these provisions, employers will need to offer affordable health care coverage to their full-time employees and their dependents, or they might be subject to the employer shared responsibility payment. This penalty and participation in the Act is known as the pay-or-play provisions. Voluntary benefits, sometimes referred to as discretionary benefits, are those that an employer voluntarily chooses to offer its employees. They primarily focus on health, wellness, and welfare. Many of these benefits would be extremely expensive for employees if they had to purchase them on their own. Even if employees pay a portion of the cost, group plans lower those costs to make these benefits accessible. The July 25, 2014 Employee Benefits News release of the U.S. Bureau of Labor Statistics reported the following. 86% of full-time employees and 23% of part-time workers enjoyed employer-provided medical care. 74% of full-time and 37% of part-time had access to a retirement plan. And 74% of full-time and 24% of part-time workers received paid sick leave benefits. Traditionally, companies have provided health insurance benefits to employees. Now, many companies have expanded their health-related benefits offerings to include benefits that focus on both health and wellness. These benefits also include health care plans, prescription drug plans, vision and dental care, mental health, and substance abuse benefits. According to a survey by Towers Watson of plan year 2014, employers that were providing health care benefits expected to pay on average $9,560 per employee for that coverage. Traditional plans include those available through health insurance carriers, community-based plans such as Blue Cross Blue Shield, and employer self-insurance. Under these traditional fee-for-service plans, an employee typically has to meet a deductible before the insurance plan pays for services, and then plans sometimes pay only 80% or less of costs. Managed care plans are the oldest of the approaches to healthcare cost containment and include health maintenance organizations, preferred provider organizations, and point-of-service plans. Major differences in the three types of plans include how payments are made and the way medical costs are determined. These plans provide health care to members for a set monthly fee for a comprehensive set of services. Primary care physicians serve as gatekeepers. Health maintenance organizations, the first type of managed care programs, originated in 1973 when the Health Maintenance Organization Act became law and allowed third-party payers to participate in healthcare payments. Third-party payers are companies, insurers, or other entities that negotiate healthcare options for employees rather than employees doing so directly. HMOs became very popular in the 1980s. They often require that employees live within a designated service area and use doctors and facilities that are specified by the HMO. The plan pays for medical services if the healthcare providers are designated in the plan. The employee identifies a primary care physician and goes to that person, who can then refer the employee for a specialist within the HMO if needed. A second approach to managed care is the use of preferred provider organizations, or PPOs. In a PPO, an employer negotiates with healthcare providers, usually in a network, for discounts. The providers then follow strict standards about the number of diagnostic tests they order and must adhere to cost controls. The employer also gives its employees an incentive to use preferred providers because when they do, the rates are lower. Thus, employers save money on their healthcare costs. Employees have greater choice of doctors than they do with an HMO, and doctors are assured of a flow of patients. If employees use a doctor not in the PPO network, they pay a higher copay. A copay is the minimum amount the employee must pay for healthcare, including a doctor's visit, a prescription, or a test. The third type of plan is a point-of-service, or POS plan. The plan can be described as a hybrid of HMO and PPO. In a POS, the employee can decide which plan to use as needed. The employee might use the HMO component to see a primary care physician, but receive treatment following a referral through an in-network physician in the PPO. Individuals can also receive treatment outside the network, but must pay a deductible. Employers have adopted a variety of alternative approaches to address concerns about healthcare plans and costs. These alternatives come under the rubric of consumer-driven health plans. These put more decision-making under the control of employees. The main idea of a consumer-driven health plan is that giving employees more responsibility for their healthcare costs will cause them to pay more attention to their health and health-related plans, care, and treatment. In the past several years, more employers have turned to high-deductible health plans, HDHPs, as a way to manage the costs of employee health care. High-deductible health plans are also referred to as catastrophic health plans because they don't pay for the first few $1,000s of employees' medical costs per year. Thus, they pay only when the employees had a major medical problem. Because of their high deductibles, these plans are less costly for employers, and employees' monthly premiums are lower as well. Employers in high-deductible plans can also participate in a health savings account. Health savings accounts, or HSAs, were created as part of the Medicare Prescription Drug Improvement and Modernization Act of 2003. A health reimbursement account is another mechanism for paying for the health care costs of employees. There are several differences between HSAs and HRAs, even though the purpose of both is to reimburse employees for qualified medical expenses. An employer, an employee, or an employee's family member can put money into an HSA. In contrast, only the employer sets aside money in an HRA. Employers can deduct the cost of HRAs on their taxes in the same way they can deduct the costs of health insurance programs for their employees. When an employee leaves the company, whether for retirement or other reasons, funds left in the account are accessible to the employee. However, the accounts are not portable. They remain with the employer that provided them, and they cannot be used for retirement income. With an HSA, the funds belong to the employee and can be rolled over to the next plan year or withdrawn for retirement, subject to a penalty if the withdrawal occurs before the age of 65. With only a few exceptions, employees who have an HRA cannot have an HSA. HSA and HRA users, when compared to PPO members, reported fewer emergency room visits, a higher rate of generic drug use, lower medical costs overall, and fewer non-routine visits to the doctor. Instead of contracting with an insurer, such as Blue Cross and Blue Shield, to design and deliver all or part of benefits programs, companies can decide to self-fund their programs. Many large employers and a growing number of medium and small employers make this decision. By self-funding, employers avoid having to pay premiums and taxes on those premiums and avoid some of state requirements for benefits. When employers self-fund, they typically employ the services of a third-party administrator to oversee the plan. Because these plans are not subject to state mandates, they actually offer employers more flexibility, which is one of their attractive features. Self-funding can save money for the company, but it's not without its risks. For example, if a member of the firm's employees suffers catastrophic illness, the fund may end up costing more for that particular plan year. By self-funding, the company is assuming the money that is set aside for medical costs and the responsibility for those costs as the plan year continues. Workplace problems such as absenteeism and injuries on the job are often correlated with employee health and safety issues and lead to increased insurance costs. Wellness programs address these issues and typically include the following: a health risk assessment to identify employees at risk for chronic diseases, the identification of programs and incentives to motivate employees, education and awareness programs to promote wellness, efforts that encourage employees to take responsibility for their health, and an evaluation of the program's outcomes. Conditions such as anxiety, depression, and substance abuse affect a worker's ability to perform their job. Estimates of the cost problems such as these for employers range from $80 to $100 billion each year. To help employees cope with mental health issues, substance abuse, and life challenges, companies offer employee assistance programs. EAPs were started in the 1970s primarily to provide a resource for managers dealing with employees who had or appeared to have substance abuse problems. EAPs have evolved from their early focus on substance abuse. Today, an employee can use an EAP to consult an attorney, find out about child care or elder care options, get information on budgeting, and seek family counseling. Many companies offer their employees the opportunity to participate in short and long-term disability plans. These plans pay a percentage of the employee's salary during time in which the employee is not able to work. Typically, short-term disability plans will pay a specified portion of your salary for 6 to 12 weeks' time depending on the plan. The benefits usually start after the employee has missed 1 or 2 weeks of work. Long-term disability typically starts after a specified period of time, typically 6 to 12 weeks, from the time the disability occurs. and pays a portion of the employee's salary until retirement age. The cost of disability claims in 2013 was $9.8 million. Even though the number of employers offering long-term disability plans for employers was up to more than 214,000 in 2013, fewer employees are electing this voluntary benefit. Accidental death and dismemberment insurance is designed to compensate employees for the loss of a body part, or to compensate an employee's family if the employee suffers a loss of limb or dies accidentally at work. The insurance usually specifies how much will be paid for the loss of each body part or for accidental death, and is likely to be valued by workers in manufacturing and skilled trade jobs more than white-collar workers. To accommodate the needs of employees for time away from a job, employers provide paid time off in the form of vacation, sick leave, bereavement leave, personal leave days, and holidays. Paid leave was the most frequently provided benefit in 2012, with 84% of private industry workers having the opportunity for personal, holiday, or vacation leaves. PTO can be specified by a number of days or years and accrued on a monthly basis and is a replacement for specified leave plans. PTO gives employees the flexibility to take off holidays or days of their choosing. Even though employees know that they have PTO, they don't always use it. One survey found that in the United States left 226 million days of vacation unused for a total loss or total worth of $34.3 billion. A goal for most of us is to one day retire and enjoy a quality of life. In the next few slides, we'll describe the Employee Retirement Income Security Act and describe the most frequent types of retirement accounts. Vesting refers to the time required before you own all or part of your retirement funds. The money you pay into retirement funds plus interest earned on that money is 100% vested immediately. This means that you have the non-forfeitable right to use these funds, even if you leave the employer before you reach retirement age. Your employer can require you to fulfill certain service requirements before you are vested in the money it contributes to your retirement account. There are two types of retirement plans: contributory and non-contributory. A non-contributory retirement plan is one in which the employer puts funds into an account without requiring the employee to make contributions. A contributory retirement account is a plan in which the employer and the employee both put money into that account. A defined benefit pension plan provides an annuity to eligible employees upon their retirement. An annuity is either a specified dollar amount each month or is based on a formula that usually involves multiplying the number of years an employee worked for the company by a designated percentage of the employee's last or highest salary. The salary can also be an average of a number of years of salary. Under this type of pension plan, the employee is promised an annuity that increases the longer the person has been with the company. Defined contribution plans have found favor with employers over the years as an alternative to defined benefits plans, as pension plan use has decreased dramatically. Under a defined contribution plan, the amount of retirement income is a function of how well the money put in the plan was invested. The employer specifies where the money is deposited, sometimes providing several options, and often gives employees the power to decide how that money is invested. 401k plan, named after the section of IRS code that permits this type of plan, allows employees to defer receiving some of their compensation until retirement. The money contributed by the employee is taken out of a person's payroll check and is accumulated tax-free until the person retires. Only when the person begins withdrawing the funds upon retirement is that money taxed. There is a dollar limit on how much can be deferred each year, however. In 2014, the limit was $17,500 for individuals in 401k plans. Flexible benefit plans, also known as cafeteria plans, allow employers to choose which benefits they want to purchase from a menu of benefits. Some companies require that all of their employees receive certain benefits, usually health insurance, but allow them to choose others they want to purchase. Some companies provide a set amount of money or credits for employees to choose these benefits. The Occupational Safety and Health Act of 1971 enabled OSHA, the Occupational Safety and Health Administration, to make sure that every worker is sent home whole and healthy every day. The Act covers private sector employers and employees in all 50 states. Since the passage of the Act, U.S. employment has nearly doubled, yet workplace fatalities have declined by more than 65%, and injury and illness rates are down 67%.